Thank you for joining us today. My name is Stephanie Anderson, and I am the Industry Operations Manager for the National Apartment Association. If you are new to our series, we welcome you. If you have been with us on this journey, welcome back, and thank you for your continued support. In an effort to provide our membership with timely operational guidance amid COVID-19, we are producing daily updates in the form of micro webinars. Each day, we will focus on a different topic relevant to the apartment industry. At this time, I would like to direct your attention to the screen. Please take a moment to review our disclaimer. Today, I am excited to introduce Paul Rhodes, National Safety and Maintenance Instructor for the National Apartment Association Education Institute. Paul will be here sharing his guidance today on how we can best protect ourselves and our residents during COVID-19. Paul, welcome back and thanks for being here today.
Thanks, Stephanie. I'm honored to be back and sharing more information with you. It's important to remember, as we're all navigating our way through this new normal that we're discovering, that we keep our eyes on a goal. Whatever the goal ends up being for us, we definitely need to have something out in the horizon that we continue to look forward to. And as the situation changes or adjusts throughout time, it's important for us and our on-site staff to keep in mind the need for us to have ourselves and our residents be as safe as possible. Our job, therefore, is to help decrease the risk of person-to-person spread of COVID-19. At the same time, we need to look beyond just COVID-19, making sure that whatever policies or procedures we put into place are there to maintain habits that are sustainable in the long haul. Thinking of going beyond just today. I mean, what we're calling the new normal today, if you even look at it a week ago, it's changed a little bit. One of the common conversations I've been having over the past few weeks in this situation is, what are maintenance staff doing on site to keep themselves and keep their residents safe? A lot of the conversation has been of, do I need to dress up like a spaceman to go into an apartment? Do I need to have a mask or something? Do I need to have a bubble around me and not get near anybody? It's important to understand that in this new normal, there is a lot of information that we can use. You know, OSHA says that we need to make sure that we keep ourselves safe. Our focus is on protecting our workers, and for us, that means we as maintenance technicians need to be protected. Far too often, personal protective equipment is the first thing on a maintenance technician's mind when we go to think about a dangerous situation, when in truth, personal protective equipment is actually later on in a hazardous situation handling decision-making process. Before personal protective equipment comes into use, we need to plan. We need to be thinking ahead. We need to be able to assess risks. Now, in the age of COVID-19, what this means is some of the questions we should be asking ourselves before we even go into a resident's apartment is, for this service request, what surfaces am I going to touch when I get into this apartment? And even before I go, what avoidance strategies can I use to keep myself and my residents safe? For instance, if it is an occupied apartment that I'm being called to go do or perform service in, are there things that if I called ahead, I could make safer for myself and for my resident? If it's a vacant apartment, can I clean it and disinfect it before I go touching or doing anything? You know, According to the CDC, the goal here is to limit the amount of spread that the virus has from person to person. The most common way, according to the CDC, that this spread is occurring is by being carried by respiratory droplets. That means when I am talking, coughing, or sneezing, small droplets of water or moisture are coming out of my mouth that, if I am a carrier, whether I feel good or not, it is those droplets that I'm trying to prevent from contaminating or infecting someone else. This means that by thinking ahead, I can protect myself and I can protect my resident. For instance, if I'm in that vacant apartment, maybe before I go touch anything or do anything in that vacant apartment, I follow the CDC guideline of using 5 tablespoons of bleach per gallon onto hard surfaces in order to disinfect the surface that I'm working on. The most important part of this entire process is to keep my hands away from my face. That way, even if I'm coming in contact with it, I'm not transferring it directly to the place that affords me the disease. Recently, the CDC has enhanced their guidelines regarding face coverings. And according to the CDC, the cloth face cover is meant to protect other people in case you are infected. That means that the mask that I'm wearing and the face cover that I'm wearing actually does a greater job of protecting you than it does of protecting me. And likewise, the mask or the face covering that you're wearing does a better job of protecting me than it does of protecting you, because we are working towards keeping those droplets away from each other. Now, with this enhanced recommendation for face coverings or for masks, a lot of questions have come forward about supplies. In other words, where do I get covers from, or gloves, or cleaning supplies? Right now, there are limited supplies available because everybody needs them. It's a universal need. And a lot of places, a lot of our suppliers are out of stock. In some cases, it means we do need to think creatively. And here's the thing, it's not just the apartment industry that's having to think creatively, it's everybody. On YouTube recently, the Surgeon General actually posted a video of how to use an old t-shirt to create a face cover. So we may need to get involved with that. In addition, it's possible for us to reuse some of our materials. Be safe when you do this. Reinforce the need for cleanliness. And finally, remember, we're all in this together. Everybody is affected by this. This is a universal situation. Smile on and keep calm. Thank you very much.
Paul, thank you so much for sharing that great information. I definitely agree with you. The best thing we can do is keep calm and keep smiling. Well, thank you all for joining us today. We look forward to seeing everyone back tomorrow for another great micro webinar. In the meantime, if you need additional guidance on all things related to coronavirus, please email CV19questions@naahq.org. Thank you all and have a fantastic day.